Hi, dear students. I'm tuning in with SolRx from the pharmacy. We wanted to talk to you about Dayvigo, which is also known as lemborexant. So this is a medication used for people who have trouble staying asleep or wake up in the middle of the night. Typically, people who are given this medication have tried other options, including non-drug measures like cognitive behavioral therapy. These are new medications that are now on the market. They are taken once a day before bed. But what's super important is that it has to be taken on an empty stomach, not with any fatty meal, because that slows the absorption and reduces the efficacy, which is super important. There are also cytochrome P450 3A4 substrates, so we have to be very careful with any 3A4 inhibitors like antibiotics and other things. What is cool about these medications is that they are dual orexin receptor antagonists. So what they do is they block the signaling that our body releases when we wake up. So when we wake up, our body releases certain signals to allow that to happen. These medications work to block that versus your Z drugs like zopiclone. They are the ones that reduce other things in the body and increase GABA, for example, increase GABA release. And so they work a little bit differently. But anyways, with that being said, when we compare these to zopiclone, zolpidem, and other medications, studies show that there's less tolerance developed with these. There's significantly less abuse potential, less hangover effects the next day, a lower risk of falls in elderly patients as well. Some patients may have side effects like daytime drowsiness, maybe sleep paralysis, but not as commonly. The reason why we don't use it right off the bat is because they're still new, right? So everybody's still used to getting your Z drugs like zopiclone or temazepam, for example. We're not used to seeing this regularly yet. And there isn't like an exact place in therapy yet. So it's not like we say, okay, try zopiclone. If that fails, do this, do this. There's no place in therapy. So people will try it and see if it works and if it's covered under insurance. It's not covered by a lot of plans yet because it is new. So it depends on the patient. It comes in 5 and 10 milligrams. So we start with 5, can increase it to 10 milligrams. But generally, side effect profile is a lot better than things like zopiclone, better tolerability, lower risk of abuse. So there you have it. Dayvigo, also known as lemborexant.